Hello, everyone. Welcome to the Lineate webinar on how to fill the health IT talent gap. We're excited you're joining us today. We've got some really good information. A couple of housekeeping things. This is being broadcast live, and we are indeed recording it so that you can get a copy of it within 24 hours or so in your email. And like before, if you want to send us any questions, since you're all on mute, go ahead and just use the chat window. We've got folks monitoring that, and we'll be able to bring it into the conversation or send it out at the end. Today, our conversation is going to center on the challenges that we're seeing in the health IT labor market. We've heard that there's shortages for providers, nurses, physician fatigue. So there are many openings, but that also exists within the health IT teams. We had to pivot really quickly a couple of years ago when COVID hit. That did take its toll on a lot of teams in terms of the fact that they had to do so many different things in a different way quickly. Plus, there was suddenly this onslaught of new connections that were needed. A lot of interoperability was required for these new apps and new systems to get connected to enable organizations to get the information they need at the place they need it. And those IT support staff, as skilled as they were, some found it an opportunity to, to resign. There's too much, the great resignation we've heard of. Others were extremely valuable, and they got poached mainly to other industries. So there are challenges in really holding on to the subject matter experts, the skilled labor within health IT, and that's what we're going to be covering today. So we're going to go over some of the market drivers as to how we got into this situation and the implications that it has on your organization when you've got few staff and a lot of projects. How do you prioritize? How do you get your budgets in order? And things are always changing, so we need to definitely adapt. And then we're going to have some solutions to that. We're going to talk about some of the customers of Lineate who have employed or used Lineate as interoperability specialists, sort of offloading the interoperability management of their interface, development and management of their interfaces to us so that they could go ahead and repurpose their SMEs, their FTEs, on the projects that are the most important for them. And in league with that is the fact that we have offerings in the cloud that can make this situation a lot easier because we've seen it. And so I'm really excited to say that today we have on this the webinar a couple of folks with some real world experience in this particular topic. We've got Kevin Day, the CTO of Lineate, and we also have Stephanie St. Stephen in Italy right now, who is our engagement manager. So Kevin, why don't you introduce yourself and let us know what it's like as the CTO for Lineate at a time like this.
Oh, certainly. Thank you, Rico. I'm really glad you're hosting, by the way. This is going to be a lot of fun. I'll just say, in my heart, I'm a technologist. I love originally, first part of my career, very early on, as a computer programmer in COBOL, using technology to help a business solve a problem. Now I have the great honor and privilege of leading technology teams to serve the healthcare technology sector. It's an incredible honor. So we have teams that deliver our cloud solutions, but also our integration engines, terminology management, identity management. And it's been very exciting, and certainly some of the staffing challenges that we're going to talk about, we've gone through those as well. So I'm happy to hand it over to Stephanie for her introduction.
Yeah, and hey, nice to see all of you, meet all of you. My name is Stephanie Santasteven, and as Rico indicated, I'm currently in Italy, where we're actually having a torrential rainstorm. But what I do for Lineate is I oversee our engagement division globally. And so what that means is we are the main point of contact for all of our engagements from a support perspective, from an account perspective, and from a technology perspective. We really kind of reach across our cross-functional teams to make sure that our customers being taken care of for the duration of our partnership. And really that's how we look at our customers, as a true partnership. And so I love what I do, being in Italy, working across the globe with customers on a global basis is very exciting. And so the work that we're doing with interoperability, it's just an exciting time to be in this industry.
Yeah, and as we've seen, this really is indeed a global situation. It's not just in the U.S. where I think most of us or most of the participants today are calling in from. So excellent. Let's go ahead and get into the main topic. So Kevin, why don't you give us a little bit of background on what is the scenario? What environment are we in? How did we get here?
Certainly. Well, I want to double click first on what we mean by healthcare IT staff. So I manage a team at Lineate that has all three of these different categories, which I'll mention. First, you very likely have an internal operations team, affectionately known as your IT team. They might provision staff machines, manage the internal servers. They might call those hardware or systems engineers. Then you very much may have a development team, and they're engineering your workflows to deliver information to your customers. So software engineers, interface engineers, database engineers, and then you may have started your transformation to the cloud, in which you might have cloud engineers, site reliability engineers, and data DevOps engineers, excuse me. The challenge is all of those different categories of technologists are in fact impacted by the current market. So very simply put, there's more jobs than people that are seeking jobs in the technology sector. I have worked in a variety of sectors, including tax and accounting, financial technology, and now healthcare technology. And I can tell you that there's a very high demand for technologists that can demonstrate they have gone through a cloud transformation, a digital transformation. If they're able to demonstrate that they've taken an institution from on-premise to cloud, they're extremely highly valuable right now. So why is this more acute in the healthcare technology sector? Well, I think we should realize that this sector is not for everybody. It is very fast-paced, 24/7, 365. Errors and mistakes are very, very costly. It could be life-threatening if mistakes are made in technology. And we also should admit that this sector, because of that fast pace, is not always quick to adopt new technologies. And also, with the onset of the pandemic, a lot more different types of sectors are offering fully remote or very, very flexible options. And that's not always possible when we're talking about an in-person institution delivering healthcare. So I'll just quickly summarize in saying that people are leaving, not only switching from one employer to another, possibly for pay and compensation, but also because of what they work on and how flexible their organization is. And that's why I think it's making it, this challenge is more acute in healthcare.
Plus, you also have new types of technology and integration. I know APIs and REST is a new mechanism for integration, and not everyone, we've got a lot of HL7 folks out there, and so there's some of the newer technology, and then how do you ramp up with this new type of technology and the risks associated with that. I bet as a result of having sort of a fluctuating IT team, that it can have some significant impact or on risks associated with completing projects on time or implementing the right software, a variety of different cybersecurity. What do you say, Kevin?
Yeah, certainly. We think about it holistically, or very simply. If you had a team of 10 and you've had 20 to 30% attrition, now you're down to 80, 70% capacity, and very likely those positions are hard to fill. It take a very long time to replace. But also, to your point, they may be folks that have expertise. They were the single point of expertise on a particular connectivity method or interface, HL7, for example, and it's going to be very challenging to find that in the market. So what happens is that then you end up really focused only on keep the lights on activities, or KTLO. You abandon strategy and you focus on just tactical matters, keeping the operation running. Then it's natural to suspend innovation, modernization, and learning opportunities for your team. And again, all of those are factors that might cause somebody that has stuck around to possibly consider leaving if they don't see a path for growth. And one more factor I would say is that the risk that this creates is that you may become slow or unable to respond to compliance requirements, cybersecurity threats, or mandatory updates. So like just as an example today, Apple published 2 operating system updates that to close the loop on some zero-day threats. And if your team is not actively pushing those updates out to the end users, you're really open to a significant vulnerability. And so, like, if your team is constrained, they may take a long time to respond to such a threat.
Yeah, I'm thinking that IT skills really should be part of, early education and high school curriculum. I mean, we're always having to do updates on our own devices and then our parents' devices, grandparents' devices, et cetera. It's managing risk is definitely a full-time situation. And I know, like, some of those scenarios where you inherited a job from someone else and you can't even find the documentation for this HL7 interface that had this one Z segment that did some weirdness, and now you need to try to figure that out. But the good thing is, there's a migration to the cloud. Maybe how does that help? Can that help?
Right. No, I definitely believe it can. And what we're seeing is our customers are accelerating their cloud journey. And I would say that instead of it, they feel like it's an obligation now as opposed to an option. That's what we have seen as a transformation over the last couple of years. You just think about it practically, that instead of having people manage an internal data center, you can repurpose them and hopefully retain them, retrain them to focus on your strategic objectives. And the end strategic objective is providing outstanding patient care. So if you're able to shift those folks from the nuts and bolts of keeping a data center up and running to help you improve those workflows of patient care, that's the win of the cloud. Now, also tactically speaking, you might be looking at your data center and realize that there's hardware that needs to be replaced. That's CapEx. And if you could avoid that CapEx and shift that to OpEx, that's very financially beneficial, depending on your financial portfolio. And finally, just being able to leverage the cloud to modernize your workflows and understanding that cloud computing, you pay for what you use as opposed to having to anticipate load. So there's not unused capacity. It's demonstrated it's able to handle very, very large volumes of data while ensuring security, resiliency, and business continuity.
Yeah, those are all great reasons for a cloud strategy. It's great to hear that people see it as an obligation, although that sounds like a little bit of a hard term. There are indeed a lot of benefits associated with that, and fortunately, we've been right there the whole time from the platform perspective. So at this point, I'd like to turn it over to Stephanie so that she has an opportunity to describe a couple of customers in their use case and how they were able to leverage us for interoperability expertise, outsourcing, and cloud and so forth. So Stephanie, what would you like to tell us?
Yeah, so a great segue was why cloud, why now, right? And so that's really what we're saying with customers is how do I approach the cloud journey? And so I'd like to illustrate 2 customers. So the first being Clinify. Clinify is based out of Chicago, Illinois, and they're one of our partners, right? Let's say use the term partner. And they actually focus on, they're a digital health company that focus on federally qualified health centers or FQHCs and clinics in underserved communities. And so really their issue or their challenge was kind of a twofold. One being, how do we approach the cloud, right? how are we going to find a solution that has the security, interoperability security, real-time data exchange, and ready to go for our customer base, for these federally qualified healthcare systems. And so really what they ended up going with and selecting was our Envoy platform, which is 100% fully managed. The second problem is why we're here, what we're talking about today. Understanding that there's a global industry-wide HCIT shortage, and then the nuance and the complexity of with FQHCs, right, adds a layer of complexity to it. And so the solution was, again, a fully managed infrastructure for them, interoperability solution for them. What that allowed their engineers to do, as you can see from the slide, is code to a standardized data model, right? Again, not having to be the experts, because Lineate's the experts. Like I mentioned earlier, a team is deployed on their behalf, and so they can really focus on serving their communities, FQHCs, underserved community clinics, and really deploying their solution. Their solution, also, I'd like to add, Clinify has a team of very experienced IT professionals. So approximately 80% of their employees are comprised of IT professionals. But what we wanted to allow them to do is to really focus on their product development, and onboard customers in much quicker, again, and leave the heavy lifting to us. And so really that's the solution that we deployed, and it enabled them to focus on their product development, and as you can see, leave the interoperability challenges and best practices to us.
Yeah, and I think if I remember correctly, that there's one aspect of the FQHC where they need to hire locally, or there's some component requires that there is local resources, and in an already short supply market, I mean, that's just got to be even that much more difficult.
That's right. That's right. So that's why I say that's like an added layer of complexity, right? In an already challenging market, is finding a needle in a haystack in a very specific community spread across the United States. And so we were happy to provide that solution to them and offset those challenges so they could focus on the real work of getting that value-based care delivered to their customers in those populations.
Yeah, fantastic. And it's all good. It's all about the more data they integrate, the better results they can have from a business analysis perspective, to then say, here's how you can tune your operations in order to save more money and earn more credits, et cetera. So that's a really fantastic case study. I think the next one is also an IT company, Biointelligence.
It is. Biointelligence. And so both of these companies are very cool. I'm always amazed at the types of customers we get, because they vary across the board from healthcare IT to provider. But this is another very innovative customer, Biointelligence. They're based out of Colorado. What they do is they provide medical grade continuous health monitoring and COVID-19 screenings at scale. So they actually have a suite, as you can see, they have a suite of products that they provide for health, remote health monitoring and RPM. And so their challenge was very similar, right? So, we have these great products. How do we deploy them rapidly in an EHR market where there are consistent updates and upgrades and an ever-changing EHR landscape? And so they also went with our product Envoy, because we are EHR agnostic. And so really what that allowed the customer to do was focus on a cloud-based option where they could essentially code and focus on a singular protocol, again, a standardized data model, and not have to be the masters of best practices and hire an entire team of interoperability engineers. Because there's, again, an added layer of complexity, especially to them, because they have a suite of products, right? And so their real issue is they have a diverse set of requirements. It's also a device company. And so their challenge was, how do we receive device data and consume it in an ever-changing EHR landscape, and then bidirectionally send that back via HL7, right? Like I mentioned, we don't need them to be the all-knowing interoperability experts, because that's what we're here for. So what we were able to do is deploy a team comprised of account managers, engagement managers, engineers, and cloud engineers on best practices, which again allowed them to really have a bespoke approach tailored specifically to them for faster innovation, easier deployments, and a smoother integration model. Mm-hmm. And so the solution allowed them to work with multiple best-in-class RPM applications and telehealth solutions, not just to address the COVID-19 pandemic, but also medical-grade care at home. Like I said, this is like innovative, late-breaking and very cool tech that we're deploying and that we're enabling these healthcare IT leaders to do on a day-to-day basis.
Yeah, and I think it's such a great story that they have a variety of data sources. It's not just a whole bunch of HL7. You got everything that you have to deal with and accommodate here, be able to do so, rapidly, incorporate it into the overall workflow and business process. And I think they too wanted to take their model international, and so bringing in the international component again of how this problem affects all of us. So you were getting into how they described or how we helped them specifically. I think I have a slide here that maybe can help orient you in terms of some additional discussion. What is our professional services model and staff augmentation? Since you see that a lot, can you elaborate a little bit more for our viewers?
Yeah, so one of the things that I think Lineate does very well, like I said, is offer this very bespoke approach, tailored to each of our customers. Depending on the need, the vertical that they're in, we have the ability to help them. So short or long duration staff augmentation, is it just an FTE for this, one integration, or are you looking for something long-term? Would you like to take on monitoring yourself at some point, or is that not something that's fiscally feasible over the next, quarter or year or multiple years? And so it's not necessarily something that we sell that's a one-size-fits-all. We understand that each business is unique globally, and we really do take that bespoke approach to tailor our professional services and staff augmentation to each customer and their needs. And it can be as much or as little as the customer needs. So we have, like I said, our fully managed offering, or from end to end, from project management to deployment and monitoring and support, where we've done the whole kit and caboodle. And then we have other customers that say, hey, especially after the COVID-19 pandemic, we're really fighting for our lives here with resources and staffing and, just fiscal responsibility in a time like this. And it's very unprecedented, right? And so we're happy to be that support that they need for now, and then transition them into a more self-supported engineering support model long-term. And so I think that's one of the things that we do very well, is that, like I said, not a blanket product. It really applies to each customer and what their needs are, both today and in the future.
Yeah, and as we keep growing and building the interoperability suite, we get more expertise on the team and can help in larger projects. It's not just a matter of getting this, plugging in system A to B, but how do you throw identity in there? How do you work with, consumer engagement? I mean, the models are changing so quickly. You need to have a framework that adjusts as well, but still has the the vigor to be able to manage it all and handle it all. And that's exactly what Lineate is putting together as we continue to build our interoperability suite. And I know that we had just come out with a new subscription services option where you can buy professional services in subscribe, so that if you can use it as needed to fluctuate with your resources as well. Small engagements, large engagements, And we've seen both. We've been had a lot of good response from customers with this option because it gives them a level of comfort that they've got a bucket of hours that they can access as needed without having to go through a large paper trail in a hurry.
Absolutely, yeah. Something the subscription service will allow the customers to do is use as needed. So
talking about a service at a high level, what can a customer expect from a Rhapsody as a service, CorePoint as a service, EMPI as a service? What is the managed service offering profile that we have?
Well, I'll start with that. The a variety of different options in terms of deploying and us fully managing the offering. And for Lineate Rhapsody as a service, Lineate CorePoint as a service, those are our flagship integration engines available in the cloud, either in the case of Rhapsody, either as Lineate managed offering to include the managed services on top of it, or customer owned, well, Lineate owned ecosystem, customer owned operational aspects. And then you shift into the Lineate Envoy managed service model, and that's what Stephanie provided two great examples of in the previous slides.
And that's where we're actually monitoring traffic, interfaces, data flows, and working with the client to determine what we do at what point, depending on the scenario. Yes.
Yeah, so I was going to say, so I think that's a perfect example for when I mentioned earlier, we can do as little or as much as needed. I can just throw out a few examples. We have customers that have been on some of our legacy on-prem partners who may have, have a suite of engineers, CorePoint or Rhapsody engineers on staff. We're happy to build the infrastructure for them from a cloud perspective, and then offer them support as needed as they go. And then we have the variable, the opposite of that, right? A 180 of that being Envoy. And like I said, it's everything from project management to delivery, but actually even beyond that. With our Envoy managed service model, we also do marketing and sales support. Again, all of our products we view as a partnership. So whether that's infrastructure or marketing and sales support, we want to make sure that we're only as successful as our customers. So we want to make sure that they're achieving their goals, their product vision, and we're enabling them to do that.
Yeah, I think that's a really, really good point, Stephanie, that, it is a mantra at Lineate that, customer success. We want their project to be successful. That's how we show our aptitude. How would an organization engage with Lineate if they were interested in some professional services or managed services or further discussion about this topic? Would they reach out to their account manager, or
they would talk to their account managers? Yeah, we have a whole team ready and willing to talk. Actually, even existing customers, we want to make sure that they have the ability to get a demo, reach out to their account manager or their engagement manager if they're in the middle of a project or engagement, to look at other products that might be a good fit down the line, and we would be happy to do that. They can also go to lineate.com and download the cloud migration guide, and there's also much more information about our products, but feel free to reach out to any team member or account manager that you have availability with.
Awesome. And speaking of the cloud migration guide, there will be a link to that in the email that you receive with the link to the recording as well. We had a question that did come in, and it's asking, what should customers or prospects take into consideration as they're looking for a partner to outsource integration work? So what are the criteria that they should be considering as they look for integration partners for outsourced work? Any thoughts?
Well, I have one thought on that, and that is you're going to need to have internal change management in going forward with a project like that. I think you'll quickly find that Lineate will be able to help and partner with you. But what is that change of of coming to us for, well, in this case, integration work, what kind of impact does that have on your current team? There's very likely, they may be drowning, but there's very likely someone on your team doing that now. And you'll want to partner with them to ensure, like, offer assurances that, listen, this is good for you and it's good for us in the long run, and you will transition to very high priority strategic objectives once we get this partnership running.
Yeah, very important. Bringing in the people who are, most, suffering in this situation. They often have very good ideas and examples.
Yeah.
How about you, Stephanie? Any thoughts on how to? Well, it sounds like with this migration, this cloud migration guide, we've done a lot of the thinking. Since we've done this so much, we've made it easy for organizations to gather the information, ask the right questions, and see what's going to be involved, so that it's not a big unknown, right? I mean, we really have the process in place and work with them jointly to make the successful project. Yes.
Yeah, that's right. And so, like I said, the downloadable cloud migration guide will have those best practices and suggestions. But ultimately, we want to work with a customer. This is especially for a migration, right? You want to partner with someone where they are still the boss. We can do big bangs, we can do a phased approach, but we really want them to lead the initiative, and we want to be in the support role. And so I think while some of those best practices are a good guide, ultimately it's up to the customer, and we want to help the customer make those really sharp and informed decisions.
Mm-hmm. Yeah, and this is something we've been doing. It's not, our first time in the cloud. We know we've got the centers, we've got the processes, the run books, etc. All put together. So it looks like we don't have any other questions. So what I'd like to do then is remind everyone that you will be receiving an email within 24 hours or so. That's going to have a link of this recording so that you can refer back to it, share with all of your friends. And it will also have a link to this downloadable migration guide. And please feel free to reach out to your account manager if you already are engaged with Lineate. If you would like some more information, reach out to us via the website. We'd be happy to put someone in touch with you. And with that, I'd like to say, ciao, Stephanie. See you later, Kevin, and everyone. Have a great day. Thanks very much. Bye-bye.
Well, thank you. Yes.
Bye-bye.